Welcome to Perth Children's Hospital. My name's David Andrews, Head of Cardiac Surgery.
And I'm Kelly, your cardiac nurse.
When you have surgery here, it's not just surgery. To us, you become part of our family.
We created this video to show you and your child the cardiac surgery journey you're about to embark upon. Our aim is to provide you with as much information to ensure you are prepared at every stage. We want to empower you with knowledge so that you can talk with your child and help them understand what is ahead of them. By watching this video together, we hope it creates opportunities for open, honest conversations.
This will allow you to reassure your child that you and us will be with them every step of the way. The more they understand, the less they will fear.
There are 3 important stages to your journey: pre-surgery preparation and appointments, admission to hospital and surgery, and post-surgery recovery. Clinic G will likely be your first face-to-face meeting with your cardiac team. It's called your pre-op appointment, and you'll likely be here for a few hours. During your appointment, your admission paperwork will be completed. We will record your child's height and weight, oxygen saturations, temperature, heart rate, respiration rate, and blood pressure. The doctor will review and ensure your child is fit, well, and ready for surgery. You will be given specific fasting and admission information tailored to your child's individual requirements. You will be given a prescription and instructions for nose cream and body wash, which your child will need to commence in the days prior to surgery. During your appointment, you will meet with your surgeon, who will discuss the surgery in detail. And remember, your surgeon loves questions.
We will meet in a room like this, where we will talk about your child's upcoming heart surgery. Initially, I will talk about the underlying heart problem and the reasons for requiring the heart operation. Then we'll talk about some of the mechanics of the surgery, the ICU, hospital stay, and post-operative recovery. Then we will discuss the risks, and finally, we'll flip it on its head and talk about the benefits of having heart surgery.
Once this has been completed, your child will undergo a number of tests: an ECG, a chest X-ray, some nose and throat swab tests, some blood tests, and potentially require an echo.
I've got a great tip for finger pricks, which can be very painful. Just shake it off.
Shake it up, shake it up.
Otherwise, if the blood's not all down in the tips of the fingers, we have to go 2 or 3 times, and it's 2 or 3 pricks that she obviously doesn't want to do. So she started with the shake it off thing.
Just put your faith in the people that are there. They've been doing this for years. They've studied, they're the best in their field, and you've got to have the faith that they're going to do what's right and they're going to fix your child.
Another really important thing that we will do prior to your surgery is look at your child's teeth. It's really important that we have nice, clean teeth generally, but especially prior to heart surgery. One of the commonest places bacteria can come from to get onto your heart after surgery is from your teeth. Hence, we will send you to see the dentist.
On the day of surgery, you'll be admitted here to surgical admissions on level 3. It's normal for you and your child to feel anxious on the day of surgery. Bringing a favourite blanket, teddy or toy will assist your child feel more comfortable.
When our daughter comes in for surgery, we do a little care package. So something new, something old, something she loves.
Bring like fun activities, like maybe an activity book. They could bring a teddy with them.
They've got a great school system in hospital where they've got teachers coming to the room to do schoolwork with them. So that's also a good distraction.
When you arrive on 3C, you'll be greeted by a nurse who will perform a full set of observations, undertake paperwork, place name bands on your child's wrist and ankle, and place some special cream on the backs of their hands to numb the area in preparation for their surgery. Once everything is in place, the anaesthetic team will meet with you to explain the anaesthetic process and what will happen during this time specific to your child's requirements. Once we have an ICU bed confirmed, the anaesthetic team will come to collect you and your child from 3C and walk you through to theatre. One parent can accompany their child into theatre and stay until your child is asleep. This is when you will leave your child in the care of our team.
Hi guys, this is the operating theatre. This is where you will come after anaesthetists have put you to sleep, and I want to show you around my operating theatre so you have a bit more of an idea of what happens. Obviously this is an empty theatre, there's instruments everywhere, there's usually at least 8 to 12 people in here to help with most surgeries. And then I want to talk to you about some of the equipment that we have here. So this one is the anaesthetic machine. This is what the anaesthetists use to monitor your child and keep them safe whilst we do the surgery. Obviously this is the operating table, which is where I operate. We've got lots of screens around which help everyone figure out what's going on and keep up to date with the surgery. Lots of other bits of equipment. But the most important bit that I wanted to show you is this machine called the heart-lung machine, or the bypass machine for a lot of you. This is a machine that's used for what's called open heart surgery, which is when I have to stop your child's heart to do their surgery. Other surgery doesn't involve this, it's called closed. It doesn't mean either is more difficult or more dangerous, it just means that we use this machine for some patients. The next thing I want to talk about is timing. And yes, heart surgery takes variable lengths of time, which is why we have Kelly, who will phone you throughout the surgery to keep you updated with what's going on. Once we have finished, we'll meet you outside of intensive care. Well, I'll explain to you what's happened and how your child is going. About 30 minutes after that, you will then be able to go in and meet your child. So once we've finished, we take the children through this door out to the intensive care.
When you arrive here in intensive care with your child, you'll be met by a group of doctors and nurses that are highly skilled and experienced in caring for children after cardiac surgery. It can be quite confronting and scary with all the machines, alarms and equipment that we use to look after your child. But you can be assured that with our skills, knowledge and experience, our staff will give your child the best care possible.
Be strong, because it's going to be hard. It's not an easy road. And use your support system whenever and wherever possible.
One tip would be to be prepared at home, not knowing how long your hospital stay is going to be, having the freezer stocked up, and little things like that at home is certainly going to be handy.
So the best thing you can do is actually get a bit of fresh air. So going for a walk around Kings Park, getting your mind off it, sitting there being anxious, biting your nails doesn't help anybody and won't actually affect the outcome.
As your child improves, they'll be moved to Ward 2A until they're ready to go home. During this time, your child will continue recovery from surgery. This may include oxygen therapy, observations, medications and pain relief.
Tests including ECGs, echoes, blood tests and chest x-ray may also be required, along with physiotherapy and diet modifications. You may also meet with social workers and Aboriginal liaison officers, all to assist in your journey to recovery. The cardiac team will continue to monitor, review and adjust the care your child requires at every stage. And as your child recovers and improves, they may be able to visit Fun on 4 to aid in their recovery with some fun activities.
So we've used Starlight, Fun on 4, and they've got a little theatre where the kids can go and sit and watch a movie and just pass the time, and there's kids activities, arts and crafts and fun toys to play with.
There's lots of organisations to help within the hospital, but the one that helped us the most is Heart Kids, and I would encourage all parents to reach out to them.
For the time period that you are or your child are in ICU, you get a room up in Ronald McDonald. So that is just the best thing, because you're close by, you've got a room, you've got laundry services.
And it's just been amazing.
When your child is ready to go home, you will receive education from the cardiac team relating to caring for your child at home, which may include long-term medications and tests, signs and symptoms to monitor at home, wound care and what your child can and can't do post-cardiac surgery. Once discharged from hospital, you will attend our post-op clinic here in Clinic G. During this appointment, your child's observations will be recorded and their dressing, if still in place, will be removed, and you will receive wound care advice. An echo or ECG may be required, and you'll be asked questions about how your child has been progressing since being at home, and if you have any concerns about their progress since discharge. Following review in clinic, you will be given advice relating to your child's recovery and a plan for your next follow-up with the cardiac team.
Thank you for taking the time with our team today. We hope this helps you with your journey ahead.
If you have any questions or queries, please don't hesitate to contact the team. We're always here to help.